Hello, it's Greg Ehlers with Einstein'S disease. We're back for our second segment with Jawad Arshad, the CEO of WOW Health. Jawad, it's great to have you, and let's dive into to one of the solutions. As we talked about in the first segment, one of the biggest problems and challenges for all consumers is just the inability to truly be educated and to find that educational channel with respect to healthcare. So we're going to dive into a solution that touches on what we ended the last segment with, and that is co-pays, further responsibilities, who's really getting the first dollar of coverage. And when we talk about that and WOW Health specifically, as we go into this, maybe you can spend a few minutes starting out here about why and how WOW Health and what you created provides to the consumer, the person in need of health care, why you went so well with the first dollar coverage through your telehealth and beyond, to not only have the transparency, but for people to realize, hey, look, I'm going to pay X, and that's what it's going to cost me. And if you could start with that, because that'll work really into the solution so our listeners understand and our viewers understand exactly why this is a solution to the problems that they are being challenged with when they utilize what they believe to be the only traditional health care insurance.
Yeah, absolutely, Greg. So I think, as you alluded to, the fundamental issue that we're dealing with is education, right? It's lack of transparency. You can't educate around something if you have no visibility into what it costs or what that is, right? So I think when we started thinking about solutions, how do we bring really meaningful healthcare access for our members? Right. The first thing that came was, well, we need to simplify this a bit. So, for example, if you have a traditional insurance plan, I challenge most anyone to tell us ahead of time before they get the service done how much that service is going to cost, right? How much is that ultrasound? How much is that MRI? How much really is that doctor's office visit going to end up costing them in aggregate, incomplete, by the time all the bills are settled? They won't, because even if you call the insurance carrier that has given you the policy, right? If you call their member support office and ask them, I'm going to get this MRI done, how much is this thing going to cost me? They won't even be able to tell you either. They'll give you some vague answer about, oh, it'll be anywhere between $400 to $800, and it depends how it gets billed and depends on, well, there are a lot of dependencies, right? So you have no visibility and you have no way of knowing. And I think that's really what WOW Health aims to do, right? Our goal is to bring that transparency, because transparency is what education is, right? If you know what it is, then you can decide what the best step would be for you. But then we also wanted to bring access to care. And access to care fundamentally then means that you are going to be able to get to see a doctor, you're going to be able to get your care taken care of, right, in a meaningful way, perhaps first without having to spend any money. So, for example, in our platform, our telehealth services are zero cost. Right? And
Say
we
that
do it
again.
this way.
I got to interrupt you there. You're providing access to healthcare at first dollar or zero cost, as people would see it. It's the first dollar of coverage. They pay you. They pay their monthly
Membership.
fee,
Yeah,
and that first dollar allows them to actually get access without any other copays. Is that what you're saying?
correct. So
That's
we know,
powerful, right? I mean,
yeah, that exactly.
for our viewers out there, what Jawad is saying is, when we were discussing the problems in the beginning, you're walking in, you're paying for the ability just to be in the office, and then when it's over with, you might actually have more money that's owed due to the fact you haven't made a full contribution to your annual deductible. And you're saying you pay your monthly membership and you get first dollar coverage. That's what I'm hearing, Jawad.
Yeah,
that's
absolutely.
powerful.
So
That's
exactly.
really powerful.
And Greg, look, there are different ways for us to meet, right? As a provider, as a physician, as with our patients, right? So sometimes it's in person, and yes, that's not going to be free. But a lot of times, according to the AMA, about 70% of office visits can effectively be done via telehealth, via telephone, or a video call. So for all of those 2 out of 3 encounters, we can conduct them across the screen. And if we do that, and we can bring that at zero cost for our members, right, then now we have at least reduced one barrier that's there in being able to obtain that care, and then really thinking about holistically what health is for our members.
No, that's and do you, statistically, post the COVID environment, the ability to have telehealth or a doctor that you can see has become and technology obviously, but we've seen a little bit of a behavioral shift, haven't we, with respect to some members of our population feel more comfortable just at home rather than sitting in a doctor's office. But the one thing that I think about, or I'm sure some of our viewers are going to say, well, how do I know if I'm talking to the same doctor? What if I talk to somebody else? What if I go and see my doctor? What's the consistency, and does everybody know what my health situation is? Do I have to keep repeating myself? Maybe you can spend a couple minutes to, allay some of those concerns and talk about your process.
Yeah, Greg. So what we do is we provide our services in what's called a membership model, right? We are not an insurance carrier. We are not an insurance product, right? So in any membership model, we are going to give our clients different options, right? So for example, in one option, someone who is somewhat healthy is not really thinking about having that continuity of care that you were alluding to, where, hey, what about if I want to see the same doctor every time so they get to know me a little bit better over a period of time, right? For them, an arrangement like a virtual urgent care would be sufficient, and they probably may not need much more than that. Now, someone else who may have high blood pressure, who may have diabetes, who may be thinking, I would like to establish a relationship, right? There is a service within our memberships called a virtual primary care. In that case, you actually can make an appointment with that same provider for any future appointments, right? And it gives you that ability to have that continuity of care that you desire. I think one of the really key things for us to recognize is that because there are different settings, telehealth versus in-person, right? Our goal here at WOW Health is to give you the option for both, right? So we always say that we are a true hybrid of healthcare delivery, in the sense that we are going to allow you to connect with a physician via telehealth. Yes, we've tried to remove as many barriers as possible, cost being one of them, and so that's gone. Another one could be transportation. Another one could be the amount of time it takes, right, to actually be able to conduct that visit with a physician. Under a normal day, you may have to drive 40 minutes, right, to get to your doctor's office, then sit there for 20 minutes before you're seen, and then, see them for maybe 10, 15 minutes, and then drive back. Well, the whole thing took 3 hours for a 15-minute appointment, right?
Yeah.
And maybe if I could just get on a video call, right, I could do it right at that moment.
That's
so I think
fantastic.
So it's removing those barriers.
That is fantastic, and that is a outstanding solution to not only the challenges with respect to the ambiguity of cost and care, Jawad, but it's also you're meeting people where they are. It seems to me, because as you mentioned, not only the hybrid model, but but more importantly, people are busy. People are trying to find ways to access that care, but do it smartly. And the most important thing is not to be getting a bill in the mail the next month or a few weeks afterwards. So I think as we leave this segment to our viewers, Wow Health, Dr. Arshad has discussed one of the solutions. On the next episode, we'll break into another solution of Wow Health, but we've got to cut away for our pay some bills here and check out to a commercial. We'll be back shortly. Thank you very much.